day, viewers. I'm Dr. Hannah Norton, representative of the Homeopathic Association of South Africa. And in honor of TB Awareness Month, we have Dr. Marelize Caminsky here with us today. In addition to being a homeopathic practitioner, Dr. Caminsky is the pathology lecturer at the Department of Complementary Medicine at the University of Johannesburg. Dr. Caminsky, thank you so much for being with us here today. How are you doing?
I'm very well, thank you, and thanks for having me.
Absolute pleasure, absolute pleasure. Dr. Caminsky, can you please take us through exactly what tuberculosis is and how it's diagnosed?
Okay, so tuberculosis, or TB as we know it, is a long-term contagious infection, and it's caused by an organism called Mycobacterium tuberculosis. What makes it a long-term or a chronic infection is that once you get it, you will basically have it for the rest of your life. Now, TB exists in two forms in humans. When you first get infected, we call that primary TB. Now, this type of TB has no symptoms. It does not actually make you sick, and you can't give it to others, but it does mean that the organism is now lying dormant or latent or asleep inside your body. In about 90 or 95% of all cases, that's it. If you have a good immune system, nothing else is going to happen with that primary TB. In fact, it is estimated that about 25% of the whole world's population already have primary TB. However, if your immune system does become weakened, your primary dormant TB may become secondary or active TB. This is when you will start getting some of the symptoms of TB and also become contagious to others. So in other words, you'll be able to pass TB on to those around you. Now, in order to make sure that TB gets diagnosed as soon as possible, if a healthcare practitioner suspects that someone does have TB, there are a few tests that they may send the person for. One of them is a chest X-ray, where they'll look at characteristic signs of TB, as well as a sputum sample. So in other words, they'll take a little sample of your saliva, and in there, they are going to look for the TB organism. Now, this will only be positive, that saliva test, if you actually have active or secondary TB at the time. If these results aren't completely kind of clear and conclusive, there is something called a tuberculin skin test that can be done. And this is almost like a skin allergy test, but instead of looking for a skin reaction to things like grasses and pollen, they're now looking for a skin reaction to the actual TB organism. They can also do a TB blood test. And then at the end of all of this, if you are diagnosed with TB in South Africa, very often your health practitioner will also recommend an HIV test as well.
Perfect. Can you take us through some of what those common signs and symptoms of the active infection would be?
When we think of TB, we think of it as a disease that affects the lungs, and a cough is going to be the most common symptom. But people may also have symptoms such as a fever or night sweats. They may start to lose weight or just feel generally kind of unwell. Even though we may think of TB as a lung disease, it also affects other organs and tissues inside the body, and those will then be associated with a whole range of different symptoms. But the most important symptoms to look out for is a cough, night sweats, and weight loss. And this combination of symptoms is very important because it can also be indicative of a few other diseases. And these symptoms in combination always warrants getting a professional evaluation of what's going on.
Can you take us through the current population statistics in South Africa related to TB?
So, Hannah, globally, just 8 countries share about 87% of the world's TB cases. And unfortunately, South Africa is one of these countries. It is estimated that about 80% of South Africans have got primary or latent TB already. And according to the World Health Organization, about 360,000 people became ill with TB in South Africa just during 2019. Now, this relates to about 615 people in our country out of every 100,000 that has got this disease. It is a leading cause of death in South Africa. And in 2019, about 58,000 people died of TB, and about 36,000 of those were also HIV positive. So TB basically, as an infectious disease, causes more deaths globally than any other infection, even if you include HIV in that stat.
That's quite remarkable. And are there specific comorbidities or conditions that might predispose to a TB infection?
So firstly, anyone who lives or works in close contact with someone with TB will be at an increased risk of getting it. Another big factor is decreased immunity. So the moment your immunity becomes a little bit weakened, it will create that opportunity for primary TB to activate into secondary TB. The problem is that in South Africa, not only do we have one of the highest TB rates in the world, but we also have one of the highest numbers of HIV infection. And HIV, as we know, suppresses the immune system. A person living with HIV or AIDS is about 18 times more likely to actually get secondary activated TB. And on top of that, when someone has both of these conditions, both TB and HIV, they speed up the progression of one another, which just means that you're going to get ill much quicker. Other risk factors include things like old age and certain medications, excessive alcohol use, recreational drug use, cigarette smoking, malnutrition, poorly controlled diabetes, as well as medications such as chemotherapy for cancer.
And could you take us through some practical aspects to prevent the transmission of TB?
When someone has active TB and they cough or speak or sneeze or even sing, the TB organism is exhaled in their saliva and little tiny droplets. And if someone is standing next to them and they inhale those droplets, they can then get TB. So the easiest way to avoid spreading or getting TB is really just to avoid close contact with anyone who has active TB. You can even go so far as to wear a mask if you are in contact with someone who does have TB, or as someone with TB, you could wear a mask to prevent the spread to others in your home, etc. And then, of course, just sanitizing surfaces and hands very regularly.
Perfect. And we are aware that with tuberculosis being such an issue in our country and in the world, generally speaking, with regards to treatment compliance, can you take us through why it's so important that individuals diagnosed with the condition adhere to their treatment strategies?
Sure, Hannah, it is of vital importance because when we look at TB, it's usually treated with a combination of 2, 3, or even 4 antibiotics that must be taken for 6 months or even longer. Once a person starts a TB treatment, they must finish the treatment. However, many people just don't. And the reality is that that cocktail of medicines that get used to treat TB can make people feel quite unwell. 6 months is also a very long time to do anything. And often people feel much better after just a few weeks of treatment. So they think, oh, maybe I'm cured, maybe I can't give it to anyone else anymore. And they stop taking it, or they just simply forget about taking the medicine because they're now feeling better. Now, the problem with not finishing your treatment is that half-treated TB can come back, and it causes something called antibiotic resistance. When we start taking any antibiotic for any condition, the weaker bacteria will die off first, while the strongest ones are going to take the longest to get killed by the antibiotic. But they also slowly figure out ways to become a little bit resistant to an antibiotic. This means you must complete your course in order to kill those strongest bacteria right at the end, because otherwise, if they remain, over time, antibiotics will become less and less effective. So with TB, poor compliance has caused what we call multi-drug resistant, or MDR TB, which is really making it harder and harder to treat TB globally.
Wow, what a wealth of information. And Dr. Caminsky, for those viewers out there who would like to learn more about TB, its transmission, its treatment, how to get tested for it if we suspect we might have it, can you direct them to some resources that they might utilize?
Sure. The South African TB Vaccination Initiative, or SATV, actually have several useful links on their website. And then also, please remember that TB TB testing and treatment is free at government clinics and hospitals all across South Africa. So for more information on clinics or where you can go, and even some basic information on TB, you can go to www.health.gov.za, and you can just click through onto your provincial health link, so Gauteng or KZN or wherever you find yourself, which you'll find at the bottom of the page. And from there, you'll get resources that are applicable to your area specifically.
Absolutely fantastic. Well, thank you so much, Dr. Caminsky, for your valuable input and your time today. And to all our viewers out there, we at the Homeopathic Association of South Africa wish you well on your health journey with homeopathy, the wellness profession. Thank you, and have a wonderful, wonderful day.